Hello and welcome to episode 32 of the Fat Doctor podcast, season 5. I'm your host, Dr. Asha Lamy. It is October the 1st, believe it or not. I don't know about you, but every year, actually, for the past few years, feels like it has been going on forever, and at the same time, feels like it's flown by. It's so bizarre. I'm just like, when will this year end? But then I realized that it's not like 2026, it's magically gonna get any better. But yeah, we're in August already. October already. See, there you are. I'm still in August. We're in October. Um, and here I am, getting ready to record some podcasts. It's the end of September at the time I'm recording this, so not that too far away from when this episode airs. And I don't know about you, but I'm kind of done with all of the agitation. Like my soul is agitated 24 hours a day. And that is mainly because of the things that I'm consuming. And by consuming, I don't mean food, I mean social media for the most part. I'm trying not to. It's hard to stay away sometimes. Um, and just the news in general and just information, all the information that I'm receiving is just agitating. So I thought in the midst of all of this agitation, I just wanted to bring a moment of calm, measured reassurance to your life. I'm going to record this. This podcast. This podcast is for fat people. If you're not a fat person and you're listening in, I just want to say thank you very much for being here. Thank you for being an ally. Thank you for supporting me. I'm so grateful for you, but this podcast is not for you. That doesn't mean you won't benefit from listening to it, because listening to a podcast for fat people will benefit everybody. But I am speaking to specifically right now fat people. Whoever you are, fat people, wherever you are, fat people, I'm talking to you. And in particular, fat people who have made a choice to take a step away from dieting, weight loss, are choosing to just be fat and stay fat. It's a bold choice. It's one I made a few years ago. And for the most part, I'm very, no, not for the most part. I am glad I made that choice. That being said, sometimes it's hard. Sometimes I need a bit of reassurance. Sometimes I wonder, what am I doing? Is this the right thing to do? And so here you are. Here I am. Sorry, here we are. And I'm just going to remind you that you're making the right choice. And I'm going to specifically tackle it from the angle of health, of course, because, that is kind of what I do. I'm a doctor. And so I guess this will be through the lens of health and healthcare, but hopefully be a reassuring podcast. So I've got a list of things I just want to say to you. The first thing is that you deserve a healthcare practitioner, a doctor, a nurse, a midwife, a physical therapist, a therapist, whomever, every single one of your healthcare practitioners. You deserve one who listens to you, who believes you, and who validates you. That's the case for people of all sizes. That's the case whether or not you choose to pursue weight loss. That is just, that should apply blanket to everyone. It is a basic human right, a healthcare provider who listens, who believes, and who validates. Someone who is actually willing to look beyond their own stereotypes, judgments, assumptions, beliefs, their own bias, and go, yeah, I'm actually going to listen to what you have to say rather than assuming I know what's wrong with you. I am going to believe you when you tell me stuff. So if you're in pain, I'm going to believe you're in pain. If you tell me that, you're tired and that this is just more than just regular tired, I'm going to believe you. If you tell me you've tried something, I'm going to believe you tried it. I am going to believe you, because why would you be lying? I'm going to believe you because you have the right to be believed. You shouldn't have to defend yourself. You shouldn't have to prove yourself to me. No, you should just be believed. Just like that. And validated too, because there is something very powerful when you as a vulnerable patient share like a what's going on with you, or this is what I think is going on, or this is what's happening in my body and it doesn't make sense and it's worrying me, it's stressing me out, I'm afraid. It's really healing actually to be told, yeah, that makes sense. Oh yeah, oh no, I know exactly what you're talking about. Of course. That's as predicted. All of those things are super validating. So you deserve that. You deserve what you deserve a healthcare practitioner who not only listens to you and hears your story, but also examines you, is willing to place their hands on you and do so in a way that is healing and not harmful. There is nothing worse than being touched. Actually, as an autistic person, you could just put the that should just be the end of the sentence. There's nothing worse than being touched. No, there's nothing worse than being touched by someone who is visibly disgusted by you, by someone who doesn't like you, by someone who doesn't want to, is being forced to touch you because it's their job. There is nothing worse than that. I was talking to someone the other day about massage and how incredibly healing massage can be, as long as you feel safe as a fat person and you don't feel disgusting, which is not often not the case. I've had a few massages I've paid a freaking fortune for and just been like, you clearly did not like touching my body. And I mean, you get paid to touch bodies, and like, okay, I understand. Not everybody likes placing their hands on people's bodies. That's totally fine. But then just don't become a massage therapist. And in the same way, if you don't like examining patients, probably don't become a doctor. Because it is like a really big part of your job. If you feel uncomfortable placing your hands on a person's body, then actually you pick the wrong job. Find another one. You know, people always say, "Oh, I'm squeamish about blood." Sure, that's important too. Like if you can't handle blood, but yeah, that seems pretty minor compared to I don't like touching people. I don't like listening to people. I don't like being around people. If you don't like that, then there's other jobs to be had. Um, your symptoms are valid, right? They are valid. Um, that's just it. And you deserve somebody who was going to say, right, let's figure out what's going on here. Again, because that's kind of their job. Um, you deserve, and I'm going to talk about doctors. I'm always trying to be really inclusive and like include all healthcare providers, but I'm a doctor and I'm speaking as a doctor. And this, of course, applies to other healthcare providers, but it specifically applies to doctors. So I'm just going to talk about doctors from now onwards and try, because it's really hard to be inclusive when I'm defaulting to doctors. So I'm defaulting to doctor mode right now, and I'm going to tell you that you deserve a doctor that doesn't default to weight loss advice. Yeah. Imagine that. A doctor who isn't going to just look at you. You walk in, they're like, right, the first thing I'm going to tell this person is lose weight. You deserve, like, when you start saying, I've got pain or I've got fatigue or I've got whatever, that they don't just go, oh, that's because of your size. That they actually engage their brain, do the thing that they were trained to do. We spent years in medical school. We started off with the basics like pathology and virology and microbiology. We learned all about pharmacology, pharmacokinetics, and pharmacodynamics. We spent a lot of time learning anatomy, learning every single tendon and muscle and bone and an organ in the body. We looked at the different layers of the skin in great detail. We had to know where the epithelium and the endothelium met. How could you tell the difference? All this stuff. We had to learn that stuff. We didn't do it for shits and giggles. We didn't do it just so that people would call us doctor. Like we learned it so that we could use that knowledge and put it into practice. We spent years going through each system of the body, cardiovascular system, respiratory system, alimentary system. We went through all of them. And we learned about all the different things that could cause disruption in the body. And then we got our medical degrees, and then we went off into the big wide world and went, whoa, actually, there's loads more to learn. And then we kept learning, and we continue to learn, and we specialize, and we get more and more, become more and more of an expert in our field. And we do all of these things so that we can figure out what is wrong and then try to fix it. It's kind of the point, right? So when somebody comes to see me, and they have a symptom, I actually want to figure out what's causing that symptom and treat it. And assuming it's due to weight and prescribing weight loss is lazy fucking medicine. Forgive my language. It's lazy it's like you just can't be bothered. It's easy. Well, it's your weight. I don't have to think now. I don't have to engage my brain. I don't have to use any of that knowledge and skill and expertise. I can just blame you and send you on your merry way, and that's my job done. And I can take a bit of a break. I get it. I get the temptation. I mean, like, sometimes we all, we have days when we just want to phone it in and not do. But that's, again, if you went into medicine because you hoped it would be easy, that was a mistake. That was your mistake. Pretty sure people along the way would have told you it's not easy. So it's not like it was, an easy mistake to make. And if that's what you were hoping for, an easy life, then again, wrong job. Find another one. Because we have a responsibility to figure out what is wrong with our patients. And it's never wait. It is never wait. Like, that's not the reason. Even if you want to argue that somebody's size is contributing to their symptoms, which I wouldn't, but even if you wanted to, it's never the actual reason. You know? Geez, do better. You deserve a doctor who treats you the way they should be treating all their patients. There are lots of studies that show that so there was one really excellent study. They took a patient sort of a case history was what we call it. I don't know how to, a description of a case. And they didn't change anything in the case apart from the BMI. So we had someone who was thin and someone who was fat. And I think they were actually thin, fatter, and then fat. I think there were three or maybe even four. But the case was exactly the same. And they asked doctors, a whole bunch of doctors, to have a look at these cases and answer some questions about the cases. And one of the things, they found many things. One was that the fatter the patient, the more the doctor actually attributed the symptoms to weight. And also, the less likely they were to treat them. And I think that's really problematic, isn't it? When you are in medical school, sit you down. Nowadays, it's all problem-based learning. I did a lot of lecture-based learning, but it's a bit better now. Let's say, let's pick I'll pick one. Think, Asha. Think of, why is it I can't think of a random thing? We'll pick a chronic disease. Well, let's pick high blood pressure just for the sake of it. So you learn all about, like, the what we call the etiology, what causes high blood pressure. Talk about the symptoms, the signs, and the treatments for high blood pressure. And then there's a standard protocol, and then, like, you learn that in basics in medical school. Then you go out into the big wide world, and then you actually have to deal with people with high blood pressure, and you learn how to treat it. And there are guidelines, and there are flow charts, and there are, like, step one, step two. It's not difficult. Anyone can learn how to do it. And sometimes someone will surprise you and not respond to treatment or have something weird and wonderful going on in their blood test, and you're like, oh, hey, I didn't expect that. For the most part, it's pretty standard. So why do we treat fat people differently than we treat everyone else? I don't get it. Why is there high blood pressure treatment and then high blood pressure treatment for fat people is different? And by that I mean when a thin person or even just a slightly overweight person goes to the doctor, like a mid-sized person goes to the doctor, has high blood pressure. Doctor's probably going to mention some lifestyle thing. Hey, you could do with a bit of exercise, hey, make sure you're getting your omega-3s and reducing salt in your diet. Some vaguely helpful advice. There isn't that much evidence to support any of this advice, but I don't think it's terrible advice. There is some evidence that reducing salt can reduce your blood pressure, and exercise is never a bad thing, especially when it comes to cardiovascular health. And well, that's not true. Exercise can be if you're over-exercising, but just general exercise advice, get your 150 minutes a week, whatever we're telling people to do. Omega-3s, these kind of things, they're fine. It's great. Good. Fine. We probably should be doing that with everyone. I think that's reasonable. I don't mind doing that. When I do it, I don't assume that the person sitting in front of me doesn't know what I'm talking about. I might say to them, hey, do you know much about about diet and lifestyle when it comes to cardiovascular health? What do you know about it? And if they go, yeah, I know that I need my omega-3s and, and they recite it for me, I'm like, great, I don't need to tell you anything then. But if they go, no, I have no idea what you're talking about, doc, then I might tell them. I don't just shove that advice on them and assume that they're basically don't know anything, because I think that's really rude and really presumptive. People are smart, they read and they figure these things out for themselves. So I check in first, but then generally a little bit of lifestyle advice never goes amiss in a new onset of high blood pressure. And then we start a treatment. Simple, right? First of all, we establish whether it is high blood pressure. I forget that, but let's assume that we've made the diagnosis. All right. Why is it that when a fat person goes to see their doctor, instead of getting the usual, like, fatty acids, omega-3s, the exercise, a fat person gets, you need to eat less and exercise more. You need to consider bariatric surgery. You need to start a GLP-1 to lose some weight. Sorry, what? What happened to the reduce the salt and omega? Oh, because weight loss. Weight loss is important here. Nothing else, just weight loss. Is there any evidence that weight loss will improve your blood pressure? No. No, none whatsoever, actually. In fact, possibly there's some evidence that persistent weight loss, so beyond 6 months, and especially weight cycling, can worsen blood pressure over time. But there's no evidence that it improves blood pressure. And even in the short term, it only reduces blood pressure by a very small amount. Like we're talking like an average of 3 to 4 millimeters of mercury, which is neither here nor there. Increases cortisol, increases inflammation, does all sorts of things, increases ADH, antidiuretic hormones, actually can increase your blood pressure if you're not careful, increases your stress levels. Like it's not good for your blood pressure. So there is no point to recommending it. But more importantly, why are you giving fat people different advice? And then often it's like, try and lose some weight and see if that'll bring your blood pressure down. Oh, hang on. There's no evidence for that. And what happens is the fat person leaves the office and then either they try and lose some weight and fail, or they don't want to lose weight, or they're just like, oh my gosh, that was really quite traumatizing. I'm not going back. And maybe they don't go back for 3 months or 6 months, maybe it's a year, maybe it's 2 years, maybe it's 5 years, maybe it's 10 years, who knows? But in that time, they've had high blood pressure. The term for that is therapeutic inertia. It's a fancy way of saying we didn't treat when we should have treated, and during that time that they weren't getting treatment, their risk factors got worse, or their health potentially got worse. So you deserve a doctor that will treat you the same way they treat all of their patients, or they should be treating all of their patients, as per protocol, as per guidelines. And it's not okay. Like there isn't a guideline out there that says don't treat high blood pressure, just give them lifestyle advice and send them away. Like that's not part of the guidelines. So it's not okay that doctors are doing this. Um, you deserve a doctor that will tell you in no uncertain terms that your weight is not a reliable indicator of your health. That will tell you that your symptoms are valid. That will tell you that you deserve treatment. That is what you deserve, because those are all true. And now some reassurances. You absolutely have the right to refuse to be weighed. Always. You always have the right to refuse to be weighed. I was talking to someone recently who said, yeah, but then they refused to fill my prescription. They can't do that. That is ethically indefensible. There are very strict guidelines about the ethical principles that underpin medical practice. And they are that we must do what is in the best interest of our patients, that we must not cause harm, that we should respect autonomy, and that we should practice fairly and with justice. And so what is in the best interest of your patients is that they can continue to have the medications that they need. If you stop their medications, you are causing harm, right? Goes without saying. Each of these principles, we have I think what they call a prima facie or prima facie, I don't know how you say it, obligation. Like, so that each of them are equally as important. We have a responsible to do each of them, right? Sometimes one will be in direct conflict with the other. For example, when we want to do something that we believe is in your best interest, like we want to give somebody a blood transfusion because they've lost a lot of blood, but they say, no, I'm a Jehovah's Witness. I can't have a blood transfusion. In this case, beneficence, which is do what's in your patient's best interest, directly conflicts with autonomy, which is what does the patient want? And guess what? Autonomy wins because doing something against a person's will, as long as they have the capacity to consent, is illegal. It is assault. You cannot do it. It is ethically indefensible. So when you say, I refuse to be weighed, people cannot cause you harm as a result of that. And there are very strict, there are very, very clear and well-defined kind of duties, responsibilities that a doctor has. And one of them is to respect a person's right to refuse without punishing them. That a person has a right to refuse treatment without fear of consequence. Anything outside of that is coercion and assault. So if you say, I don't want to be weighed, and the doctor says, well, then I won't fill your prescription, then that's assault. Now, there are situations where we need a weight in order to safely prescribe something. So now safety, do no harm, safety is coming in here. So I might need your weight in order to safely prescribe something. It's very rare, by the way, very rare that I actually need your weight to safely prescribe a medication. But let's just say there is a situation where I actually need your weight in order to safely prescribe your medication. Then I might say, listen, I understand you don't want to be weighed, but in this case, I need your weight in order to prescribe this medication. If you still say no, then there might be an argument for why I wouldn't prescribe that medication. Not all your medications, but that medication, because potentially I could be giving you the wrong dose or I could be harming you. So this is now very tricky. This is very, very gray area. But in situations like this, I think it's very simple because a person can say, I don't want you to weigh me. And then I can say, okay, I understand, but I actually really need to weigh you in order to check the dose of this medication. However, it's really simple. I'll weigh you. I'll note your weight. I'll prescribe the medication, and that's it. We don't have to discuss it. You don't have to look. I don't even have to put it in your notes. You don't have to put it in a person's notes, by the way. And if you do, there are ways, if you say, I don't want to see it on my notes, because a lot of us have access to our electronic records now, there are ways of doing this. It's not difficult. So you can just say, okay, I understand. I respect that. Would it be okay if I checked your weight without you looking? I promise not to discuss. I'm just going to look at it just so that I can prescribe this medication. It's perfectly reasonable. And I very rarely do I meet people who say that's not okay. And if it's not, then we have to discuss it because autonomy is important. But yeah, other than that, you can refuse to be weighed. You can always refuse to be weighed. Always. I don't care what they say. Oh, we need it for our records. No, you don't. The insurance companies, no, 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 that is a lie. There isn't any rule, regulation, policy out there can force someone to do something against their consent. There just isn't. Autonomy is sacred, right? So no. And if someone is trying to force you that, then they are trying to force you to do something against your consent. And again, that's assault. You can also, by the way, refuse to discuss your weight. So if you're just like, I don't care if you weigh me, but I do not wish to discuss my weight. And even if you're not weighing me, I do not wish to discuss I do not consent to discussing my weight. The end. Again, doctors have said, yeah, but if the patient comes to see me and wants my advice, then they're just going to have to take my advice. No, sorry. It does not say that. As I said, there is no reason, there is no excuse, there is no sort of like loophole in which we can get away with forcing people to do something they don't want to do. I might say, I'd like to talk to you about your weight. And you might say, no. And then I'll say, okay, the end. It is my responsibility as your doctor to ask your permission. And if you say no, then I won't do it. And if I have been, I'm not going to say negligent, but if I have forgotten to ask your permission beforehand and you just put your hand up and go, actually, I don't wish to discuss my weight. I don't consent to discussing my weight. At that point in time, I shut up and that's the end of it. If I come back to it, if I'm like, well, I try to persuade you, or I try and push my agenda, you know, I think I've talked about this before on this podcast, we're quite comfortable about talking about consent when it comes to sex nowadays. I think my kids were clued up about consent from a very young age. And I think most of us understand that if you say no to sex, even if you're like halfway through, even if you like, it doesn't matter. When you say no, no, that's the end of that, right? And any attempt to persuade you otherwise, to put pressure on you, whatever, that is not okay. We understand that that's assault, right? And the same things apply in medicine. So if you say no, I don't want to discuss my weight, that is the end of the conversation. By the way, you can refuse not just to be weighed, to discuss your weight, but also you can just refuse to lose weight. I know that doctors will say, if you don't lose weight, we won't treat you. They think they can do that to pressure you. But again, doctors don't have the right to refuse treatment unless you do what they say. Like they just don't have the right to do that. And some of you will go, yeah, but you know, they do it anyway. Sure. But again, it's ethically indefensible. They don't have the right to do it. And so what they might do is they might try and pressure you to do it. And you can just turn around and go, no, I refuse to lose weight. I'm not doing that. That is not an option. No. And then you need to ask, and to be clear, are you going to deny me treatment if I refuse to do what you ask? Are you now saying that I no longer am entitled to treatment? Are you saying that you refuse to treat me? And if you're saying that, please write it down in my notes that you refuse to treat me because I didn't consent to weight loss. Because nobody has the right to force you to do something you don't want to do. I talk about consent a lot, especially when I'm talking to healthcare professionals. And then when I talk about consent, I'm like, consent is this very kind of theoretical concept. Everybody has the right to decide what happens to their body. In order to consent, you need to have informed consent, which means you need to know about the benefits, the risks, all the available treatments, including the option of no treatment. Informed consent means you have the right to refuse treatment without fear of repercussion. Um, that's informed consent. But alongside informed consent comes agency. Agency is much less theoretical, it's much more practical. Do I actually have the means by which to exert my autonomy? So you might not have the financial agency because the only way to, because it's costing you money. Maybe it's insurance, maybe it's that you have to go privately or pay out of pocket or whatever. Like sometimes it's financial. Sometimes it's just social agency. Like you're not powerful enough to stand up for yourself. You're not like you want to, that you technically have the right to, but the doctor has all the power in that moment and just goes, no, no, I'm not doing that operation. Hospital policy. The hospitals have no right to deny people surgery. I mean, like it's not okay, but they do it anyway. The reality is very far removed from the theory. So the ethics and law that I studied back in medical school, which was uncompromising, unfailing. This is the law. These are your duties of care. This is what you sign your name to when you become a doctor. This is how you practice. But in reality, that's not what's happening. So I am conscious that here I am saying all these things to people, and you might be going, that's wishful thinking. You do not need to lose weight in order to be entitled to treatment or care. You don't. But in reality, sometimes you feel like you don't have a choice. And God, I wish I had a magic solution for you. I do know that when doctors are infringing upon your right to consent and you're infringing upon your autonomy, that there is a way to fight back. I know this because I know the law and I know how to fight back, and I've been successful helping other people to fight. The thing is, they rely on us not fighting because we're too tired and we don't know how. And that's the problem, isn't it? Is, it's one thing to know that you can fight back. It's a very different thing to actually fight back. It's a different thing to be able to stand up and say no. Um, but I do know that it's possible. I know that what I'm saying today is correct. All those things I said about what you're entitled to, what you deserve, what you should have, how doctors should be treating you, that's fact. There's no question about it. It's just fact. It's just the truth, but may not be your reality. And so when reality and truth collide, it can be pretty fucking devastating, actually. Pretty devastating. And if that's the case, if you're listening to me right now and you're just like, this is just unbearable, I can help. I'm here to help. I enjoy helping. I enjoy standing up to my colleagues and saying, no, you can't do that. And as I said, I've helped a fair amount of people to get the surgeries that they were being denied, to get the treatment they were being denied, or just to know how to stand up to their doctors. I was asked by a client recently, at what point in time do I just need to accept defeat and just try the weight loss jab, Like, at what point in time do I just go, fuck it, that's it. That's my only option now. And my answer was, I will support you no matter what you choose to do. You get to give up the fight anytime you want to give up the fight. Because everybody has the right to just go, this is too much. I don't want to do this. But if you're asking me when is the right time to do it, there is never a right time. There's no such thing as being too fat. There is no limit to this advice. This statement about, you're entitled to, you don't need to lose weight to be entitled to treatment or care, doesn't have a BMI cutoff. You can't turn around and go, yeah, what if the person's 600? Yeah. Shut up. Just shut up. And no, there is no limit. Oh, what if this person is, really, really sick, cardiovascular? Again, no. Just no. There is never going to be a point in time where I will go, you know what, in your case, yeah, you should probably consider weight loss. It's never going to happen because there's no evidence to support it, because it's not in your best interest. And I've said it over and over and over and over again, and I'm not going to say it. I'm not going to have to repeat myself, but just know there is no limits. There is no time, a point in time at which you can just that you should not, you can anytime, but that you should just give up and listen to what the doctor says. They don't get to win this fight because they're in the wrong. And oh man, as I say that, I'm just very much reminded about how wrong things are at the moment. Things are so wrong. People keep saying things that are so wrong, that are so fundamentally wrong. They keep saying the sky is orange, or no, what color is the sky is green. The sky is green, and you're like, it's not. It's blue. Well, sometimes it's blue. I live in Scotland. Oftentimes it's grey. But it's not green. It's never been green. The sky's not, it's not possible for the sky to be green. But they're just like, no, the sky is green. And then they punish you for saying otherwise. We're living in very difficult times where we are not allowed to even speak the truth anymore. And it, people just keep saying terrible, horrible things. And so in the midst of all of that, it just feels like this is a pretty hopeless, helpless fight. And it may feel that way, it may. But it isn't. Because like I said, this is working. I am watching people stand up, fight back, and it's working. It is working. I have actually had some really good conversations with doctors recently, not weight inclusive doctors at all, quite the opposite, who are working from a weight normative point of view, who are actually like, no, you know what, you're right. I thought I'd have to convince them some more, and there's still a lot to learn, and that, they're still very much caught up in diet culture, but actually far more reasonable than I thought they'd be. That, I mean, I say that because I'm a doctor and I'm having a conversation with a peer. I'm not suggesting that they're reasonable with you. I'm sure they're not. They're just reasonable around me. What I'm saying is, it isn't hopeless. I have created a very simple little, what do they call it? I call it stop dreading the doctor's appointment. Stop dreading your doctor's appointment. And I've just created this little simple, easy to use toolkit. Part one is what to do. It's about before the appointment. So, sorry, a toolkit to surviving doctor's appointments. That's all it is. Just how to survive a doctor's appointment. So many people will come to me and say, I'm dreading my doctor's appointment. And one of the first things I say is, cool, like, let me know, like, let's sit down, write a list of all the things you're dreading. And they go away and they write a list, and it's often a very long list. And they say all of these things. It's always the same thing. I can guarantee what's going on that list because I've heard it's the same thing every single time. Very, very valid, very understandable, very justified. So I created a toolkit to help people to deal with these very, very common scenarios. So the kind of before the appointment, and then part two is like in the appointment, questions that you can ask, phrases that you can use, and just how to get through an appointment. And then part three is after the appointment, which I think is really important. And I don't think we spend enough time talking about this. Especially if it was, even if it wasn't, even if it was a positive appointment, even if you come out thinking that was good, oftentimes you come out thinking it was good, and then if you spend some time reflecting on it, you're like, oh, actually, it wasn't as good as I thought it was. But if you think it was bad, which it often is, it's really important to have some time to reflect and also to take care of yourself and also to what I like to call close the loop, because otherwise what happens is you have this appointment and you leave and then the loop stays open and you just keep going back and back and back and back. You want to close the loop. So if a doctor says a terrible thing, it's not okay, it's not right. What you choose to do about that is totally up to you, but it's important that you process it. So I have like a part one before the appointment, part two during the appointment, part three after the appointment. It's really simple, it's really easy. Try and make things as simple and easy as possible. Yeah, that's on my website. I'll pop it in my newsletters. It's in the No Way Net. It's on the No Way website. I'll put it somewhere really obvious. I'll put it in my social media, in my links and everything, so you can just access it, and it's really easy. And hopefully, yeah, will help some of you who might be listening to this and going, yeah, it's all well and good, Asha, but I hear you. And if you do find that even with all the help, you go and see doctors and they're still being really difficult, then yeah, as you well know, I work with people on a one-to-one basis. And I like working with people on a one-to-one basis. I have some time at the moment. October's pretty free. I mean, it's the 1st of October. So, but yeah, if you want to work with me, let me know. All right. Well, that was today's episode. Next week, I'm looking forward to talking about this. It's gonna be about how what's the name of, let me go to my list quickly. What is podcast 2 on my list next week? I'm talking about how losing weight won't prevent health problems, but specifically I'm going to be talking about the lie that we've been sold that being fat is bad for your health. And I'm going to explain why we believe this. Because a lot of people don't actually know, and they have some bits. I often hear about BMI, and people will often talk about this chap called Kettle that they've heard of. Maybe they'll mention a man named Ansel Keys you might have heard of. I'm going to tell you the full story. I'm going to break it down for you step by step how we went from minding our own business to being fat is a disease. It happened in the space in my lifetime, believe it or not, in the space of a few decades. Pretty incredible, actually. So yes, I'll be sharing that with you. So tune in next week after that, and then because it's October, I have 2 weeks off. So 3 podcasts on, 2 weeks off. I'm actually really looking forward to that. But yes, see you next week. Bye bye, folks.